Welcome to the Jessica Danae channel. If it's your first time here, welcome. If you're back, you've been rocking with me, rolling with me, all of that, then you already know. Today we're going on a journey. You guys are going to be my support system. I did not tell y'all the date of the surgery, but today is surgery day. Today I'm getting surgery on my wrists. Today we're going to get it fixed. And if you missed it in the previous vlog that I told y'all what was going on, I have a partial torn ligament, and then I also have a cyst that ended up developing, and we're going to go in there, and if other things are going on, they're going to fix it. But yes, we're going on the journey. We're going to see the before, the after, the after. So I'll tell you all about it, how I'm feeling, how it was, what they did. T-minus like 2 hours and 45 minutes. All right, y'all, I'm gonna go over the surgery fit. So I have some biker shorts, and then I have some socks with my slides. You know. Oversized tee, and then a tank over me because I could pull down the shoulders. They told me they don't really know what they're doing with my wrist, so, well, they told me they didn't know what will be the aftermath for my wrist, like what kind of brace it will be in, if I'm going to be in a sling or what. So that's the reason why I have the oversized tee, and then I have a tank. This is our surgery fit for today. Got the braids going on, got all my jewelry off. So it's time to go. We have 2 hours till surgery. I'm back home from surgery, and I got some in and out, and I got the Neapolitan milkshake. If you don't know, you can order all 3 of the flavors. Something for y'all. But I'm back. I have some pain, but not like a lot of pain. It's numb, and then there's like a little bit of pain, and then when I move my fingers, I could feel it. But everything went good. He said that there was more frailness in there than expected, especially for my age. And I never injured my wrist before, so I'm not really sure what's going on with that. But he said in the future, like when I'm older, that I might get pain again, and then I'll probably have arthritis. But right now, I just have my in and out. And then for this hand, it was just the IV. Those IVs hurt me, like, ugh. Last time it hurt me too. So I woke up after surgery, and I guess I wake up fast after surgery. So my previous surgery, I woke up really fast, and everybody was like surprised. They're like, your patient is up. Like, and this time I woke up and I was just alert, ready to go, talking, moving, everything. So I guess next time, they said if I ever have surgery again, just to let them know that I wake up fast after surgery. I guess it's an issue. And I get really cold after too, so most of the time they have to give me warm blankets. So that's like the only thing that happens after anesthesia with me. But I'm gonna eat, and hopefully the pain doesn't start kicking in yet. But so far, so good. And he said it should be better in 4 weeks, and then I would have some pain when it comes to doing push movements still. He said that could take up to 6 months. So we'll kind of see how it goes, but we did it, we made it. We're here. So now we have to deal with this thing. In 2 weeks, I'm gonna get a brace though. I'm supposed to see him and go get a brace. Well, I'm gonna eat my food before it starts getting cold. It's time for an update. It's about 6 o'clock. I honestly felt like it was later than what it is, but yeah, it's 6 o'clock. I did re-up on my pain pill, so I don't really know what it's actually feeling like, but in my mind, in my brain, it's not as bad. I still have numbness. I believe she said I'll have numbness I'll have numbness up to midday tomorrow. And they rather I could wiggle my fingers, which I do have pain when I wiggle them, but not severe pain. I just kind of feels, I would say more of an ache rather than a pain. Yeah, I feel like the achiness and everything. Thumb is numb. I think we're doing good. We'll see how I feel tomorrow morning. I think that's going to be the next update. Will be tomorrow morning after I slept for a while, and then I'll wake up and see how it's feeling, how it's moving, how it's grooving type of thing. I'm going to show you how to open a bottle with one hand for those of y'all who, when you're maybe home alone and you need to open a bottle if your hand is messed up. Bottle. You have to use a surface that is kind of gonna, you could dig in there a little bit, right? Twist. Boom. Take your pill out. How do you close it back up? Now, if you have the ability to close that like that, cool. But if not, you do the exact same thing. And you twist the other way. And that is how you open a pill bottle. It's the next day. It's about 7 o'clock. Early and at it. Early bird gets the worm. Doesn't change. How much pain am I in? It's okay pain. Do I feel it more now? Yes. Does it cover more area of hurting? Yes. Is it still numb? Yes. Can I move my fingers as much as yesterday? No. It hurts more. So it does hurt more. The area that it hurts, where the numbness, I'm assuming the numbness is knocking out, it's starting to hurt a little more. Besides that, it's okay compared to last year when it was like from May to December I was in pain. I feel like that actually hurt more than this because I could not move my hand. It was hard to do my daily activities, so it was me just going through the pain every single day, and then my hand was in a brace. And then I learned last year, because my hand was in a brace that long, of how to sleep. So I like to sleep with the pillow, not under my arm per se, but you know where there's the pillow, and I'm trying to show you with my broken hand. At the end of the pillow, it's more low, but then when you get to the middle of the pillow, it gets that plump. I like to have the end of the pillow by my elbow, and so it kind of elevates my hand. That's what I prefer. When I have it just plopped there on top, that's uncomfortable to me. That's a trick for y'all. But yes, I do feel my hand more. I do feel the soreness. I do feel more pain, and we'll just see how it goes, because you know, every day is going to be different. But it's not too bad today, so we'll do an update in a few hours just to see how it's going. But until then, I'm just chilling. All right, y'all, it's like midday and it's starting to hurt more. I think the numbness is just wearing out, so I'm starting to feel it more, and it's starting to feel heavy. Like, I don't know if you guys, like, that's pretty bulky, right? But it's starting to feel like heavy. So when I move it, if it's just sitting there, it's fine. But once I try to move it initially, it's starting to hurt. And then my fingers, like that, yeah, I can feel it all now. This is midday, and I'm staying on top of my pills, so we'll see how it feels tomorrow. Tomorrow can either be the worst day, or tomorrow could be a better day. So there's no telling from today. So we'll see how it goes. So it's day 2 of post-op. I had surgery 2 days ago. It hasn't been 48 hours yet. It's about to be 48 hours in 4 hours. But I woke up okay. There's a little more feeling in my hand. I wouldn't say there's a lot of pain, but I do feel it. It's achy. And then certain movements of it, yes, I feel some type of pain. I pretty much, when I hold it here, we're good. When I put my hand straight or by my side or something like that, that's when I feel more pain around my wrist when it's in here. I could move my fingers a little more than I did yesterday, but there's still pain, no more numbness, and so far so good. So I'm gonna touch bases with y'all in about 2 weeks. That's gonna be my post-op appointment with my doctors. We're gonna take this off and then I go into a brace, and then we'll see what it looks like. We'll see my stitches, and then I'm supposed to get pictures. I'll catch you guys then. Stay tuned for the 2-week post-op where I'm able to show y'all more and tell you how my movement is going, and if I have to go to hand therapy again and what's going on. So until next time.